I wanted to talk about just kind of the aftermath of dealing with trauma. There's a lot more to my trauma than what I got into because I was at the hospital for 10 days. And, even after the hysterectomy, I was still dealing with just like really crappy people talking to me and saying things that weren't really true, like trying to gaslight me into thinking that these things just happen sometimes. Like my body did something to cause this, and it's like, not really. Like I had a posterior presenting baby and a very painful long labor, and what I needed was good labor support so that I could have a vaginal delivery, which was totally possible. But instead, I had a C-section pushed upon me, and even me kicking people out trying to have a vaginal birth, I wasn't given enough time on my own to accomplish that because the baby was stuck at 0 station, and, doing 1 mile circuit wasn't enough to get her all the way descended through to the point of her crowning. Although they said I did make it to +1 station, which is like on the way past the most narrowest point of your pelvis. So to me, and I also had a strong urge to push. So that tells me that my labor stalled because of interventions and bad staff in my face. So after the labor started to pick up again, I had a lot of hope that I was going to be able to do it. And then they quickly crushed all that hope by telling me I should just C-section and, informing me that this was really dangerous for me to just try to birth on my own, all that kind of stuff. So I gave up because I didn't really give up. I just chose, okay, if C-section is really safest in this instance, I'll do that. I was never against a C-section if it was necessary. I just really, really wanted to try to not have a C-section if I could help it. And the fact that the baby was born just fine, and she had a cone head, and then I had such devastating outcome from the C-section really makes me hate that I had a C-section. Obviously, moms will always say suffering's always worth it if it means the baby gets to stay alive and be okay. So, again, if that was the only way I could have had her safely, then I guess so be it. It just sucks that my OB didn't know how to give me a safe C-section. So I've been doing a lot of research since having to go through all that on birth and the history of birth and studies on different things used to help with birth and postpartum hemorrhage and all this kind of stuff. And I've learned a lot, and there's like a lot in my brain now that I want to get out, kind of compile all that information so that somebody else might benefit from it. And I think the biggest thing is women are really shamed throughout pregnancy and throughout birth, and it makes them make choices that are not intuitive. And the biggest thing I see is like there's a huge difference between hospital birth and home birth versus like maybe a birth center birth with a midwife. And a lot of OBs will talk down to the decision to make to have the woman birth at home or at a birth center. They just act like you must be very stupid if you want to do it that way. And of course, no woman wants to be seen as stupid, and most women are taught to respect authority and to respect education. And so they look to the OB for advice, and they see that OB is saying home birth is very dangerous. And then, of course, there's always headlines of like home birth's gone wrong. And so then women are like, oh, I have to have it at the most safest place possible. And that was me. I was all for home birth. And then, being a flight nurse and a trauma nurse and all that, I was like, God, if I hemorrhage, there's no blood available. If I really need a C-section, there's no OR available. And these things you can't always delay. Even if you live within like 20 minutes of a hospital, I know as a transport nurse, every point at getting a transfer to happen causes delay. So it takes a minute for a midwife to decide, okay, this needs to be transferred. And some midwives are actually so pro home birth that they really don't want to transfer. And that can lead to poor outcomes. And that's hard to know if your midwife has that kind of bias ahead of time. So it might take her a really, really long time to decide, okay, this needs to be transferred to the hospital. And then you're waiting for an ambulance. And then you're waiting for them getting a report and taking you to the hospital. And then you're waiting for a report to be given to the receiving team and them to acknowledge you as their patient and accept care and all this stuff. Then you're waiting for orders put in by that OB so that things start to happen. And, you know, some teams are super fast and some teams are severely slow. As a transport nurse, I was always blown away, like when I would hand a patient off to somebody, how long it took them to do just basic things, you know, and they might be surrounded by a bunch of people, but a lot of people are just standing around not really doing a whole lot. So as a transport nurse, flight nurse, I was always very pro, like initiating anything I could start so that that was already in progress by the time I arrived to the hospital with the patient so that there was no delay in care, because those delay in cares really add up. So